Hey everyone, welcome back to Healthcare Provider. Today, we're talking about something that affects millions of people worldwide, celiac disease. It's a condition that can have a huge impact on your life, especially when it comes to the foods you eat. So, let's break it down and see what it's all about. 1. What is celiac disease? Celiac disease is an autoimmune disorder where eating gluten, a protein found in wheat, barley, and rye, triggers an immune response. This response damages the lining of your small intestine, making it harder to absorb essential nutrients. In people with celiac disease, gluten doesn't just cause discomfort. It can lead to long-term health issues if not managed properly. 2. Common symptoms of celiac disease. The symptoms of celiac disease can vary from person to person, but here are some common ones you might experience. 1. Chronic diarrhea or constipation. 2. Bloating and abdominal pain. 3. Fatigue. 4. Skin rashes like dermatitis herpetiformis. 5. Iron deficiency anemia. Some people may also experience weight loss, headaches, or even depression and anxiety. 3. Who is at risk? Celiac disease can develop at any age, but there are some groups at higher risk. If you have a family history of celiac, you're more likely to develop it. Other autoimmune conditions like type 1 diabetes or thyroid disease also increase your risk. For how is celiac disease diagnosed? So, how do you know if you have celiac disease? The first step is a blood test to look for specific antibodies that indicate an immune response to gluten. If those levels are high, your doctor may recommend a biopsy of the small intestine to confirm the diagnosis. Remember, it's important to not stop eating gluten before the test, as it can affect the results. 5. Living with celiac disease. The gluten-free diet. If you're diagnosed with celiac disease, the only treatment is a strict gluten-free diet. That means avoiding all foods containing wheat, barley, rye, and their derivatives. The good news? There are plenty of delicious, naturally gluten-free foods to enjoy. You can still have fruits, vegetables, meats, and grains like rice or quinoa. Plus, there are more gluten-free products on the market than ever before. 6. Hidden sources of gluten. But here's the tricky part. Gluten can hide in unexpected places. Foods like soy sauce, salad dressings, and even some processed meats may contain gluten. That's why reading food labels is so important when you're living with celiac disease. Always look for the gluten-free label or check the ingredient list carefully. 7. Potential complications if left untreated. If celiac disease isn't managed, it can lead to serious complications, including malnutrition, bone weakening, infertility, and even an increased risk of certain cancers like intestinal lymphoma. That's why early diagnosis and strict adherence to a gluten-free diet are crucial. 8. Tips for managing celiac disease. Here are some tips to make living with celiac disease easier. 1. Plan your meals ahead and always have gluten-free snacks available. 2. Educate your friends and family about cross-contamination, especially when eating out. 3. Join a local or online support group to connect with others managing the same condition. Having a community can be super helpful as you navigate the challenges of living gluten-free. That's it for today's video on celiac disease. If you've learned something new or found this information helpful, make sure to like and subscribe. Have questions? Drop them in the comments and let's keep the conversation going. Thanks for watching, and remember, living gluten-free doesn't mean living without delicious food.